The 2025 GEMS Symposium begins today and it's expected to end tomorrow. And this year's event marks a special milestone as the medical aid scheme also celebrates its 20 years of existence. And Chriselda Lewis is there. She joins us now for more information. Chriselda, good morning. And I was saying, we touched on this on Monday during our medical segment. But of course, it's a very important matter looking at the size of the scheme and of course, all of the issues that people are grappling with regard to medical aid schemes. But over to you to tell us more about it.
Absolutely, Sakina. And, GEMS is celebrating 20 years. A number of things that the delegates at the symposium will be touching on are issues relating to affordability, accessibility, also, digital transformation. These are key areas, amongst others, of course, that delegates here will have conversations about. We don't have much time, but I want to bring in the principal officer, Dr. Stanley Mulwabi, to tell us more. Dr. Stanley, thank you very much indeed for your time this morning. 20 years, quite a milestone. What do we reflect on 20 years later in terms of GEMS?
Good morning, Chriselda, and to the viewers. As you have already mentioned, it's about sustainability, it's about affordability, it's about a changing landscape in terms of digitization. And in our symposium this year, we'll be having experts in those various fields who will be looking at sharing with us as players in the healthcare funding industry, and also with our members who will be joining us also via the virtual platform. We are expecting just under 1,000 participants will be on our visual platform. So it is really, as the theme says, building a sustainable and affordable future for our members, creating value in a healthcare landscape that's changing.
Yeah. And affordability is one of the key issues I think that, members would raise. Affordability in an economy that is not doing well. But medical aid is very, very, very important. How do you ensure that, your users also get value for their money, tying that into affordability? Dr. Mulwabi.
Well, it's been one of our biggest challenges this year. At the beginning of the year, we had an annual increase that our members were not really happy with. Yes. And we are busy now dealing with that, looking at those contributors to the increases. And what we would love to achieve is to remain affordable as a medical scheme. But it is challenging. It is challenging because there are several factors that contribute to that. The aging profile of our members, the fact that technology changes, and as new technology is introduced, it becomes more expensive to access that. And that is the balance that we need to strike between affordability, but continuing to have our members having access to quality health care.
Absolutely. Dr. Mulwabi, thank you very much indeed. I'm just told we're on the last minute, so you're right on the ball. Thank you very much indeed. Dr. Stanley Mulwabi, who is the principal officer at the Government Employees Medical Scheme. The symposium is taking place here today. Just some of the issues that Dr. Mulwabi had mentioned. Digital transformation, some of the experts will be touching on that. But issues of affordability and access for members of this medical aid scheme, those are key issues, Sakina, which will be addressed here this morning, amongst many other issues, of course, which we'll speak about on the program or on the channel a bit later on.